So I've reflected somewhat on what I can actually talk to you about today in relation to Part 3 of the Children and Families Act and education, health and care plans. And given that the theme of today is problem solving, I thought that I would have a look at how I think Part 3 of the Children and Families Act can improve access to services and support. So there has been much debate over the past few months about whether these reforms are actually going to improve access to support for disabled children and their families, some of which has already been touched on today. And some people have championed these changes as being a real opportunity for bringing about real change. But there are also just as many people who have questioned whether these reforms are even needed at all, particularly at a time of real austerity and where local authorities are already battling with cuts to their budgets. So, for my part, I can see that there are real opportunities under this Act to help improve services for disabled children, which I'm going to touch on briefly today. I can see that there are a number of improved legal rights, but I also think, equally, there are some missed opportunities, and I think that there are a number of real barriers in turning those legal rights into practical realities on the ground. Because we all know that just because something is written in law doesn't actually mean it's going to happen in practice. And part of the problem solving is looking at what those barriers are as to why these things aren't actually being delivered on the ground. So, first of all, to provide in 20 minutes an overview of Part 3, obviously the most significant change under the Act is the introduction of education, health and care plans, and with it a new assessment process for assessing the needs of disabled children. One of the real benefits is that it will run from birth to 25, provided that that young person remains in education. So the talk that we've heard earlier about parents being worried about falling off cliffs when you reach transition, hopefully, this will have the ability to stop that happening, because that single plan will run with that young person from primary school all the way through to when they enter adult services. Under the new Act, there are also new rights to request personal budgets, and there's also an introduction of the idea of direct payments, which is having the cash for some aspects of SEN provision. We've also seen School Action and School Action Plus being abolished and introduced with a new graduated approach to SEN support. So that won't happen immediately, that's going to happen over the next year or so. There's also going to be changes to tribunal appeal rights, so that the rights to appeal will extend to the age of 25, where that young person is still in an educational placement. And also there will be a transfer of the appeal rights from parents to the young person themselves when they reach compulsory school age, and if they have capacity to be able to make those decisions themselves. There are also new requirements to consider mediation before a parent is able to go to tribunal. And I know that has been a cause for concern for many as to whether parents are going to be being bought off their legal rights through mediation processes. And of course, this is only a duty to consider mediation. This isn't a duty to actually mediate. And there may well be some cases where that is absolutely appropriate, but it won't be the right thing in every case. And I think it's important that parents understand, or the young person understands, that they have the choice as to whether they engage in that process. Under Part 3, there are also a number of duties in relation to joint planning and commissioning of services. Now, to an extent, we have always had duties on local authorities and health bodies to work together. So this isn't new, but I think it's the first time that we've seen these duties set out in such detail in an Act. So there are lots of duties in relation to responding to requests for information between local authorities and their partners, and strategic joint planning between local authorities and clinical commissioning groups. Another big change under the Act is the introduction of a local offer. Now, a local offer, every local authority ought to have published their first initial local offer on the 1st of September. I'm not sure how many of you have seen, if you put your hands up, who has seen your local authority's local offer. I'm pleased that that's more than, when I've asked this question in other talks, it's more than hands than usual. But every local authority should have published a local offer. And in that local offer, it should be setting out all in one place the education, health, and social care provision which are available for children with special educational needs and disabilities across their area. And with that local offer, there is a legal duty on local authorities to consult in relation to the contents, and all comments which are received by anybody who wants to comment on the contents of that local offer need to be published, and those local offers need to be reviewed over time. So a lot of people have questioned whether this local offer is really just a directory of services. You know, there's no enforceability over it. They don't have to do what they say in the local offer. But I think, if nothing else, it will provide real transparency as to exactly what services are available in each local authority. So you can compare local authority to local authority on what their criteria are for accessing respite care, or what their criteria are for doing an EHC needs assessment. All of their policies will need to be transparent and published on their websites. So if people are concerned about policies or potentially unlawful blanket policies for different criteria, it will make things more transparent because it all has published in one place. And then finally, we have some new principles which underpin decision-making, which I'll look at further in a moment. So I mentioned at the beginning that I thought that there are some improved legal rights under Part 3 of the Children and Families Act. Now, I'm not sure if that's a view which necessarily everybody would agree with, but I certainly think that there are some improved legal rights. And one of my jobs as a lawyer is not just to identify the problems and the barriers, but to look at the law and to say, how can we use this law to make things better for children? So I have to find the legal arguments, to find those enhanced legal rights, and then use them to help improve provision. So I've listed here what I think are some of the key improved legal rights. The first of which is the extension of rights to provision to the age of 25, including the appeal rights to tribunal on the special educational needs aspects of plans. So, as I said before, there has been, and every day I speak to another parent who has experienced that falling off a cliff and have lost all their services when their child leaves secondary school or transfers into adult services. This at least has the potential to stop that happening if it is properly complied with, because if the child qualifies for an EHC plan, and obviously that in itself is a problem, but if the child qualifies for an EHC plan, then it means that they will have that plan with them for as long as they remain in education, right up to the age of 25, if that's necessary. Another important new legal right, which I think is a really good thing, is the new enforceable health duty. So you'll recall in the old statements of SEN, Part 3 was the SEN provision, and that you had a legal enforceable right that whatever was in Part 3 of the statement had to be provided by the local authority. Now, after much lobbying by many campaigners and organisations when this bill was going through Parliament, we have ended up with an enforceable health duty. So when you get to the health part of the education, health and care plan, and it sets out what health provision that child or young person requires to meet their health needs, there will be an enforceable duty for the first time that that provision must be provided. So, and I think that is a really, really positive step forwards. Another positive step forward is the ability to extend the provision of services post-18 provided under children's services. So we won't have, which can sometimes be quite artificial for parents, at 17 and a half, they're accessing a whole range of services from children's services, and then suddenly that has to stop when the child turns 18, when perhaps their needs may not have changed. And so Part 3 provides the ability to extend the children's services provision for as long as that child continues to have an EHC plan, so they can continue to receive provision from children's services. Now, this is a discretionary duty on local authorities. It's not an absolute duty. They don't have to extend services. But when they are exercising that discretion, they've got to do it lawfully and fairly in a very transparent way. There's also a real focus under the new Act on preparation for adulthood. So the new SEN Code of Practice, which we had just before the summer, has got a huge section on new duties on schools, local authorities, health partners for preparing young people for adulthood. Now, we had something similar under the old SEN Code of Practice, but it went nowhere near as far as what's required under the new SEN Code of Practice in terms of planning and joint planning and preparation. And then finally, just on improved legal rights, I've just picked on 3 very small examples of some of the subtle changes which I think might actually make a big difference to parents on the ground. So the first is there are new timescales for the procedure following annual reviews. So any parents who have gone through the annual review process probably will have experienced that new recommendations will be made at an annual review of your child's statement. And it may be 6 months before you ever hear anything from the local authority as to whether those amendments were accepted, whether a draft statement is going to be, amended statement is going to be issued. Under Part 3, the regulations now set out a very specific timescale. So the head teacher has to send the report to the LEA within 2 weeks. The LEA have then got to respond within another 2 weeks, and then they've got 8 weeks to then issue a draft statement. So that's really clearly prescribed as for the timeframes. So hopefully that will stop the amendments and requests for amendments just sort of falling into the ether and never actually being taken forwards. The second of these small but I think important duties is the new duties on schools and other institutions to admit. And so this will extend to further education colleges, it will extend to academies, so that whatever school is named in the child's education health plan, so the equivalent of Part 4 in your statement, there is now a duty on that institution to admit that child. Again, another positive step forwards. And then finally, there is a right for parents to request that local authorities obtain advice during the assessment process. So under the old legislation, local authorities had a set number of professionals that they would have to contact for advice during the assessment process. So educational psychology, perhaps therapy, social care, and the school. Now, the parents have a right to say to the local authority during the assessment process, we would like you to go and get an advice from this person. So it could be a private therapist or a consultant or somebody who is involved in supporting that child or young person. And the local authority have got to then go and get an advice from that person. So I think that will hopefully improve the quality of some of the assessments and make sure they are properly holistic assessments, and not just by statutory services, but by everybody who is involved in supporting that child or young person. I mentioned earlier that there are a number of principles which underpin the entire Part 3 of the Children and Families Act and these SEND reforms. And they're set out in Section 19. Now, I've put them under the heading opportunities rather than improve legal rights, because I think it's yet to be seen how these aren't things that are going to start and change and didn't start and change on the 1st of September. These are principles which are going to require cultural and systemic change within every local authority in order for them to be properly seen. But essentially, the 4 principles which will underpin all decisions which local authorities take are, first of all, the views, the wishes and feelings of the child, young person or parent. So there is a real emphasis under the new Act that, and I think it's been touched on already today, that the child themselves or the young person and the parents need to be as involved as possible in all decision making. And the second one, again, the importance of their full participation in decisions. And that is all decisions which local authority take when they're exercising their functions. And it could be something simple about just making sure that meeting times are accessible for parents to attend. Or it could be making sure that the young person has an advocate to support them at those meetings and that they're able to participate in meetings themselves. The third is the importance of the child, the young person or the parent being provided with the necessary information and support to participate. And I have put this as one of the barriers, which I also think to why, at the moment, the Act may not be able to fill its full potential. In order for this all to work, parents and young people have to know what their rights are under this Act. And they have to know and be given good quality information and support. But this is required under Section 19. And then finally, which as a lawyer I think is the one which excites me most in terms of potential, is the need to support the child or young person to achieve the best educational or other outcomes. So this is really striving to looking at the best possible educational outcomes for children and young people. Now, these are duties which the local authority must have regard to, and so, rightly so, a lot of people have questioned whether actually they have any meaning at all when they are only duties to have regard to things. But as a lawyer, I've used other similar due regard duties to really make a difference. So if you look at the duties under the Equality Act, the Public Sector Equality Act, and Section 149A, those are due regard duties, the duty to have due regard to promoting equality. Yet I've used those to stop Birmingham City Council introducing critical only eligibility criteria for adult social care. I've used them to stop care homes closing. I've used them to stop respite care provision being provided. So I don't think we ought to underestimate the power of the due regard duties. And I do believe that they do offer a real opportunity for improving provision for disabled children and their families. So missed opportunities. I do think there are a number of missed opportunities. I think that the fact that they didn't introduce a new enforceable social care duty is really disappointing, and that we are still relying on the patchwork of very complex law in relation to children's social care legal rights. There is no separate appeal rights, there's still separate appeal rights for the education, health and social care elements of the plan. So despite, us all hoping this would be this opportunity to look at the child's needs holistically, if you want to challenge it, you have to challenge the education aspect to tribunal, and then the health and social care aspects at the moment have to be challenged separately. Another, I think, really worrying aspect is there's no appeal right in relation to the outcomes section of the education, health and care plan. So this is a new part of the education, health and care plans, which we didn't have in a statement, where there's a real focus on outcomes. And there's a whole section in the plans where every type of provision and need, you have to have an outcome, a goal to be met. Yet, you can't appeal the outcome section to tribunal. And particularly for young people who are going into adulthood, those outcomes will determine whether that child continues to receive an education, health and care plan at all. And if they don't have the right to appeal that to tribunal, I think it leaves them in a really vulnerable position. I also think that there was a missed opportunity in relation to the limitations on the availability of direct payments. A lot has been said about the introduction of direct payments for SEN, and I was involved in working with parents under the pilot scheme in using those direct payments, for example, to access private therapy provision, which was brilliant and worked really well for the families. But there have been a number of caveats placed on this right to request a direct payment, and in particular that it must be an efficient use of resources. And if you actually look at what that means, the practical reality is that it probably wipes out most parents' requests for direct payments, because most local authorities and NHS will have block commissioning arrangements of therapy services, which are always going to be cheaper. Well, not always, I think, but sometimes be cheaper than getting a direct payment and buying in that service at an hourly rate. And finally, all of this new system only applies if you meet the criteria for an education, health and care plan, which is having SEN provision, and needing SEN provision that requires a plan. So if you are a disabled child but you don't have SEN, or if you are a child with SEN but you don't meet the criteria for an education, health and care plan, a lot of these rights won't be available to you. So there will be some children who will be on two separate systems. You'll have some children who are on EHC plans, then you will have other children who are on the existing system in relation to social care and health care. I also mentioned very briefly some of the barriers which I think are in place to stopping these changes and the potential for these changes being seen on the ground. First of all is the speed of implementation. This bill, and there was a lot of work being done during the consultation stages, the green paper stages, to try and get this right. Yet at the end, we had a huge rush of all of the regulations, so that we had, for example, the SEN Code of Practice came in June, just as parents, schools were all going off for summer holidays. And the transitional guidance from the government came out 3 days before the 1st of September. So what I'm seeing across the country is that nobody is ready, and that people are either just not following this new system or they're rushing, and I don't think either are necessarily a good thing. I mentioned before implementing a new system in times of austerity and the practical difficulties with having the resources and the funding to implement this properly. Access to decent legal advice and support, which is something which Luke is going to speak about. The complexity of the law regarding the social care parts of the EHC plan. So although there aren't any new legally enforceable duties, the government has tried to make this a little clearer by setting out 2 different parts of the social care aspects of the plan, the duties which local authorities have to comply with and the discretionary ones, but it's still very complex, and I don't think that's going to make it easy for parents and young people to access services. Decision making for young people. There is a real potential with the new rights for young people, which of course, rightly under the Mental Capacity Act, assume that the young person will have capacity to make these decisions when they reach school age. But there may be some young people who are very vulnerable, and I know a lot of parents are very worried that when their child or young person reaches the age of the compulsory school age, they are suddenly going to start to be excluded from decision making. And it's really important that local authorities understand these rights in relation to decision making for young people so that they aren't misused. And then finally, the significant misinformation and lack of knowledge. I've listed here just a list of just some examples of things which I've heard in the last 2 weeks. So, a school must publish a local offer. The school needs to pre-populate the EHC plan and send to the local authority to issue. That a personal budget is a cash payment. All of those things are completely incorrect, yet I've seen them all written down in information that has been given to either parents or professionals in the last few weeks. And so if we can't get these basics right, then that it's really fundamental that parents have the right information to be able to properly move forwards with this process. So, solutions. Access to specialist and good quality information, advice and support services. I think there needs to be much closer monitoring by central government of implementation of these changes and considering the use of sanctions. It should not have to be left to parents and young people to enforce this and police this themselves. There has to be, we've heard about the local government ombudsman, opportunities for judicial review and tribunal. That all requires the parents to have to be the ones that initiate it, but there needs to be someone else who's doing that as well and looking at whether these things are actually being implemented. Additional training for professionals, and genuine engagement with children, parents and young people. I've mentioned finally the local offer because, as I said before, I think that this does offer an opportunity to improve services through being able to have that dialogue with parents and genuine co-production in terms of what services are going to be available. So, as a concluding remark, I think that for me, the jury is still out on whether Part 3 is actually going to improve access to support and services. I think that there are real opportunities there for it to happen, but I think that probably there were opportunities under the old law as well. The fundamental problem is the same problem that we have always had. It's about parents knowing what their legal rights are and how they can enforce them and how we get local authorities to comply. And Part 3 is not going to solve either of those problems. That is something that we will all have to work together to do. Thank you.